After the maxillary final impression and before you start to collect mandibular information, you have to check when the mandibular Easdent teeth are occluded nicely with maxillary Easdent teeth. Can the patient bite down at centric relation and achieve video smaller than the preset video? If the occlusion of maxillary teeth has changed a little bit and the maxillary and mandibular teeth cannot get perfect occlusion, warm the mandibular Easdent tray in hot water, then push the mandibular tray against the maxillary Easdent impression to let the teeth occlude together nicely. To make it harden faster, you can let the cold water cool it down. Now you have maxillary and mandibular Easdent teeth occlude nicely. Put elastomers on the buccal hooks to hold maxillary Easdent impression with the mandibular Easdent tray together and put them in the mouth. Seat the maxillary Easdent impression back to the correct position. If the patient's mouth cannot open large enough to fit both maxillary impression and the mandibular tray in, put maxillary impression in the mouth first. Then put the mandibular tray in the mouth and align the mandibular Easdent teeth well with the maxillary Easdent teeth. Let the patient bite down in centric relation until the mandibular tray touches the tissue at the first spot. Let the patient hold this position. Use Easdent measure to compare the pre-measurement with the distance from the lower border of the septum of the nose to the lower border of the chin. If the distance is smaller than the pre-measurement, you have enough room. You can go to record with moldable material directly. If the distance is bigger than the pre-measurement, or the tray is pinching at the tissue somewhere, you need to do adjustment first. First, check which arch needs to be adjusted. If your maxillary impression was too thick, you may find the incisal edge is too low or the horizontal plane is not at the correct position. You can trim the maxillary teeth short by using a disc. If you have a model trimmer, you can also disinfect the maxillary Easdent impression and use the model trimmer to trim away from the occlusal surface. If the incisal position is correct, keep the anterior not touched. Just trim away the posterior position. The second molar area of maxillary Easdent impression may affect catching good impression of the retromolar pad area. You can cut the second molar area away and give room for the mandibular Easdent tray or impression material to cover the retromolar pad areas. If maxillary Easdent teeth are in good position, you just need to adjust the mandibular Easdent tray. Put both maxillary Easdent impression and mandibular Easdent tray in the mouth with the teeth nicely occluded together. Ask the patient, anywhere hurting or pushing too hard on the mouth. You can quickly identify the location of the high pressure area by loading super fast bi-registration material in the area and sit the tray back in the mouth and let the patient bite down again. You can either grind away the show-through area or hit the area in the hot water and bend the area with your finger or let the patient bite down more to mold the supporting frame when the area is still warm. If the buccal or lingual supporting frame is too far away from the ridge, you can also warm the area in hot water and bend the supporting frame to adapt to the ridge better. Do not put the teeth in the hot water. It may change the occlusion with the maxillary Easdent teeth. Repeat the step until the distance is equal or smaller than the pre-measurement, and no supporting frame is causing pain in the mouth.